And May is Stroke Awareness Month, and with us we have Dr. Amir Hassan to talk about the signs of stroke, what you can do to prevent it, and the new devices being used to detect them. Thank you so much, Dr. Hassan, for being here with us this morning.
My pleasure.
So let's start off with those risk factors for stroke. What are they? And particularly here in the Valley, we do have an increased risk for stroke.
So particularly hypertension, diabetes are the two most significant risk factors in the Valley. There's also a high prevalence of diabetes, heart disease, and basically all of these things combined are increasing the patient's risk of all cardiovascular diseases, heart attacks, as well as stroke.
So do you think, okay, so we were talking about that study right now, it talks about the fruits, the vegetables. Diet then can be a direct linked factor to stroke.
Of course, so diet modifies your blood pressure as well as your diabetes. If you have it, it helps you control your sugars if you're eating more vegetables, for example, versus carbs. But basically diet and exercise, controlling your high blood pressure, controlling your diabetes, following your physician's orders and medications help prevent any future diseases.
And there's also going to be genetic factors as well that you need to look out for.
Correct. So males are more likely to get stroke than females, and you also have a family history of stroke. Those are the types of things you can change. So to make up for it, try to exercise more. 30 minutes a day, at least 4 times a week, controlling again your blood pressure, your sugars, and eating a healthier diet. Less fried food, less meats, more chicken and fish.
That's right, because once you have a stroke, you can't reverse that. So what do you need to look out for? What are some of the signs that somebody may be having a stroke?
So the American Heart Association came out with this great acronym FAST, F-A-S-T, so FACE is for facial weakness, A, arm or leg weakness, S is speech disturbance, and T is time to call 911. So those are the most common things that are noticed, and basically the key is to come in early. One study we performed here in the Valley looking at border state Hispanic population showed that there's a significant increase in death in the population here. And one of the main reasons is they're not getting the clot busters, the IV TPA. The reason is they're coming in too late. They're waking up with strokes, or they're sleeping on and they're saying, I'll check it out tomorrow. Once you have any of these symptoms, you need to get to your closest primary stroke center.
Okay, and then once you are at that stroke center, for example, Valley Baptist, there are a few different things that they're going to do once they admit you. And Valley Baptist, and you're one of the doctors there, has one of the most advanced facilities, correct?
Yes, so we're an advanced primary stroke center, and we're going towards comprehensive. And basically all that means is during the first 4.5 hours, you can get the IV medication. Once that time clock is over, that's it at most centers. But we can expand that time window to 8 hours in anterior circulation strokes and up to 24 hours if you have a clot in the back of your brain, because that can kill you. So with those, you basically increase the chance of having a good outcome once you're outside of the TPA time window. And we use different devices, a different machine, in order to go in there, pull the clot out or suck it out.
Man, we hear about strokes all the time, daily basis, and definitely so many things that you can do to prevent it from happening to you or a member of your family. Thank you so much for being here with us this morning.
My pleasure.
And of course, we're going to have more information on this on valleycentral.com.